Every 40 seconds, someone in the United States experiences a stroke. That is a truly sobering statistic. Even more startling is this truth. Many individuals, especially women over 60, experience clear warning signs of a stroke up to a week before it fully hits. These are not always the dramatic, sudden symptoms we expect. These are often subtle whispers from your body, easily overlooked or mistaken for minor health issues. At Senior Forward Health, our mission is to empower you with life-saving knowledge. Today, we are diving deep into these often ignored early indicators. Understanding these 9 silent stroke signs could make all the difference, not just for you, but for your loved ones too. We will uncover what your body might be telling you days, even a full week, before a major stroke event. This information is crucial for maintaining your brain health and overall well-being as you age. Stroke is a leading cause of disability and a significant health concern for older women. Many of us are taught to recognize the classic stroke symptoms, often remembered by the acronym FAST. We will cover FAST later. But what if your body gives you a preview, a crucial head start that allows for timely medical intervention? Up to 43% of stroke patients report experiencing these clear warning signals in the days leading up to their stroke. Sadly, these vital clues are frequently dismissed. They are brushed off as fatigue, stress, or just another part of aging. This dismissal can cost precious time that is critical for minimizing stroke damage and improving recovery outcomes. Knowing these earlier, more subtle signs empowers you to act. It enables you to seek medical attention when a brief episode of dizziness or a fleeting change in vision could be your body sounding an alarm. Let us explore these 9 early warning signs that every senior woman needs to know. Sign 1. Sudden, brief weakness or numbness on one side of your body. This is perhaps one of the most common and easily dismissed early signs. You might experience a sudden, temporary weakness in an arm, a leg, or even one side of your face. It could feel like an arm or leg has suddenly fallen asleep or gone numb, but without any clear reason. Perhaps you are trying to lift something and find one arm is surprisingly weak for a moment, or you might feel a strange tingling sensation that affects just one half of your body, only to disappear quickly. This type of symptom is known as a transient ischemic attack, or TIA. A transient ischemic attack is often called a mini-stroke. These temporary blockages in blood flow to the brain are a major warning sign. They tell you that a larger stroke might be imminent. Do not ignore even brief episodes of weakness or numbness, especially if they are localized to one side of your body. Sign 2. Sudden, temporary vision changes. Your eyes are a window to your brain's health. If you suddenly experience blurred vision, double vision, or even a complete loss of sight in one eye, even if it lasts only a few minutes and then clears up, this is a critical red flag. You might describe it as a shade being pulled down over your eye, or seeing everything through a fog. These visual disturbances are often a direct reflection of issues with blood flow to the brain, specifically to the parts of your brain that process vision. Because these changes can be temporary, many people dismiss them, thinking it was just eye strain or needing a new prescription. However, these fleeting visual issues can be powerful early indicators of stroke risk. They demand immediate medical evaluation, even if your vision returns to normal. Sign 3. Sudden, unexplained dizziness or vertigo. Everyone gets dizzy sometimes, right? But if your dizziness comes on suddenly, without explanation, and is accompanied by other symptoms, it can be a warning sign. This is especially true if you feel like the room is spinning around you, a sensation known as vertigo. This type of dizziness might be accompanied by sudden headache, changes in your vision, or even unexpected weakness. These combinations can signal vascular problems affecting the balance centers of your brain. Do not confuse this with a simple head rush when standing up too quickly. This kind of dizzy spell feels different and more severe, indicating a potential disruption in your brain's blood supply. Sign 4. Sudden trouble speaking or understanding speech. Imagine you are talking and suddenly your words come out slurred or jumbled. Or perhaps you are listening to someone speak, and their words just do not make sense to you. This is not just a slip of the tongue. This is a sudden difficulty with language. It can manifest as trouble finding the right words, speaking in sentences that are hard to understand, or having trouble comprehending what others are saying. These issues, known as aphasia or dysarthria, suggest a problem in the parts of your brain responsible for communication. Even if these episodes are brief, lasting only a few minutes, they should be taken very seriously. They are often dismissed as being tired or simply having a senior moment. But for senior forward health, we know these are serious signals. Sign 5. Sudden, severe headache with no known cause. This is not your typical tension headache or migraine. This is often described as a thunderclap headache. It is an excruciating headache that comes on suddenly and intensely, reaching its peak severity within 60 seconds. It is a headache unlike any you have ever experienced before. It might be accompanied by a stiff neck, nausea, or vomiting. While not all sudden, severe headaches indicate a stroke, such a symptom, particularly in older individuals, warrants immediate medical investigation. It can be a sign of bleeding in the brain or another serious cerebrovascular event. Never dismiss a headache of this nature as just another ache or pain. Sign 6. Sudden problems with balance or coordination. Are you suddenly finding it hard to walk a straight line? Are you stumbling, tripping, or feeling unsteady on your feet without explanation? A sudden loss of balance or coordination can be a significant stroke warning. You might feel clumsy, have difficulty coordinating movements, or find yourself veering to one side when walking. This can be particularly concerning for older women, who might attribute it to joint pain, arthritis, or general unsteadiness. However, if these issues come on suddenly and are not related to an obvious injury or condition, they could be signaling a problem with the part of your brain that controls movement and balance. Your cerebellum, for instance, needs a steady blood supply to function correctly. Sign 7. Sudden, unexplained fatigue or drowsiness. We all feel tired sometimes, but a sudden, profound, and unusual wave of fatigue or drowsiness that is out of character for you can be an early stroke sign, particularly in women. This is not just feeling a bit worn out. This is a significant drop in energy, a persistent feeling of being unwell or extremely sleepy, even after adequate rest. Women, in particular, may experience more subtle and nonspecific stroke symptoms, and extreme fatigue can be one of them. While fatigue has many causes, if it appears suddenly alongside other vague symptoms, or if it is just a feeling of being unusually and overwhelmingly unwell, it is wise to consider it a potential warning. It is your body telling you something is critically wrong. Sign 8. Sudden, brief memory problems or confusion. Have you experienced a sudden, fleeting moment of confusion or a brief episode where you could not recall recent events? Perhaps you felt disoriented for a short period, forgetting where you were or what you were doing, only for it to clear up quickly. These short-term memory lapses or moments of disorientation can be early indicators of a transient ischemic attack. They are often dismissed as simple forgetfulness or brain fog, common complaints as we age. But if these episodes are sudden, without obvious cause and resolve quickly, they are still important signals. They indicate that parts of your brain may be temporarily deprived of blood and oxygen. Pay close attention to sudden changes in your mental clarity. Sign 9. Sudden, unusual nausea or vomiting. Nausea and vomiting are very common symptoms, often linked to digestive issues, migraines, or even motion sickness. However, if you experience sudden, severe nausea or vomiting that comes on without any clear explanation, especially if it is accompanied by other symptoms like a severe headache, dizziness, or vision changes, it can be a warning sign of a stroke. This is particularly relevant if there is no apparent food poisoning, flu, or other typical cause. These gastrointestinal symptoms can sometimes occur when a stroke affects the brainstem, which controls vital functions and can cause feelings of sickness. Do not just write off sudden, unexplained sickness. Consider it in the context of your overall health. Your digestive system might be reacting to a neurological event. Now, you might be thinking, Dr. Miles, these signs sound so subtle. How do I know when to act? This is the climax of our discussion. The key is the word sudden and unexplained. These early signs, especially in older women, are often temporary and can be easily explained away. But it is precisely this temporary and subtle nature that makes them so dangerous when dismissed. These are your body's critical alarms, giving you a chance to intervene before a full-blown stroke occurs. They are your chance to save your life or prevent severe disability. Do not wait for the classic debilitating stroke symptoms. If you experience any of these 9 signs, even if they resolve quickly, seek medical attention immediately. Speak to your doctor or consider urgent care. Explain that you are concerned about early stroke signs. While recognizing these early signs is crucial, it is equally vital to know what to do if a full stroke is suspected. Remember the FAST acronym. This is for Immediate Emergency Response. F stands for facial drooping. Is one side of the face drooping or numb? Ask the person to smile. A stands for arm weakness. Is one arm weak or numb? Ask the person to raise both arms. Does one arm drift downward? S stands for speech difficulty. Is speech slurred? Are they unable to speak, or are they hard to understand? Ask the person to repeat a simple sentence. T stands for time to call 911. If you see any of these signs, call 911 immediately. Do not drive yourself or let someone else drive you to the hospital. An ambulance can provide crucial medical care on the way. Preventing a stroke involves proactive steps throughout your life. At Senior Forward Health, we always emphasize the importance of managing your risk factors. This includes maintaining a healthy blood pressure, managing conditions like diabetes and high cholesterol, and adopting a heart-healthy lifestyle. Make sure to get regular exercise, maintain a balanced diet rich in fruits, vegetables, and whole grains, and limit processed foods and excessive sodium. Do not smoke, and if you drink alcohol, do so in moderation. Regular checkups with your doctor are also vital for monitoring your vascular health and discussing any concerns. In summary, these 9 early stroke signs are your body's advance warning system. Do not let their subtlety lead you to dismiss them. Sudden, unexplained changes in weakness, vision, balance, speech, headache, fatigue, memory, or even nausea are not just a part of getting older. They are calls to action. Your health and your future depend on your vigilance. Senior Forward Health is dedicated to equipping you with this critical awareness so you can live a longer, healthier, and more vibrant life. We encourage you to share your thoughts and experiences in the comments below. Has this video been helpful to you? Let us know what country you are watching from. And for more expert advice on women's health over 60 and healthy aging, make sure to subscribe to the Senior Forward Health channel. We are here to support your journey to optimal health. Thank you for watching.